Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
If you hear back from the state or from us that you are positive, you may not have a call that gives you a lot of additional information. We are very far behind because of the large number of cases that have become positive recently for doing our case investigation. So what do you do if you are positive? Remember that if you have a positive test, then you need to self-isolate at home, meaning that you stay at home during a 10-day period during which you live in a different part of the house, where you eat, and hopefully you have separate bathroom facilities there, and you don't come in contact with the rest of your family members without all of you wearing a mask. That is isolation. This is different than quarantine. Quarantine is for people who've been exposed to someone with a virus, and they need to be staying separate or staying at home for 14 days. We still recommend the 14-day quarantine period. If you possibly can do it, that is the safest way to go. However, the CDC has recently made new recommendations to reduce the period where people need to quarantine if they've been significantly exposed. If you're in that situation, per the CDC, you should quarantine for 7 days if you have no symptoms, and at the end of that, go and get tested. Then after that, you would be able to go back into society. The point at which you would get tested is 5 days after your quarantine, and you stay in quarantine through the whole 7 days. If you choose or are unable to get tested, then you would need to quarantine for a full 10 days. That is if you're asymptomatic. If you develop symptoms, anytime during any of those periods when you're quarantining, you need to go and get tested. If you have been in quarantine for 10 days without a test and you have no symptoms, then according to the CDC, it would then be okay to go back out into society. The risks are much lower for you to transmit the virus without symptoms then. We still recommend the 14-day period. There is no evidence out there that says that the quarantine, that the infectious period, or what we call the incubation period for the virus has changed. It's still 14 days, the incubation period. So the safest thing to do is to stay in for 14 days after you've had a significant exposure.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.